Welcome to this episode of Beyond 2020, a project of the Nebraska Optometric Association. I'm Dr. Andrew Bateman, your host for tonight, and I have Kay Duncan, a school nurse with Adams School here in Lincoln and with LPS, Lincoln Public Schools.
Correct.
Well, welcome, and thank you for joining us tonight. As we were kind of discussing, the whole purpose of this is for parents, teachers, nurses, other care providers, to just get information about how groups work together and resources that are available out there, and maybe a little bit of pulling the curtain back so they know what goes on behind the scenes too. So,
absolutely.
Thanks a lot. We appreciate it.
Oh, I'm glad to be here.
I know as a school nurse, you have a lot of obligations at school at the beginning of the year, so that's one of the reasons we wanted to have you here, besides the ongoing care of kids at school. First and foremost, from a parent side of things, what are some of the expectations of I don't know, objectives or screenings, whatever you want to call them, that you have to try to complete, not just in eyes?
Sure. Well, at the beginning of the year, like right now, we're very involved in getting the students that are required to have physicals in and vision evaluations. And those are as you know, our kindergarten students new to the district from outside of the state of Nebraska. So we're working on that, working on immunizations. Our next focus will be on the mandated school screenings that are mandated by the state. Mm-hmm. In LPS, our guideline is we have the first round of school screenings done by December 1st. Okay. And that is just so our philosophy is that it doesn't do any good to screen a student in April or May and discover they haven't been able to see all year. And no wonder they're struggling in class. So we work very hard. I will say I'm probably one of the ones that have them done the soonest because that's just my thing. I need to have them done by the end of October at the very latest. Sure. So we screen all students who are, all students grades preschool through 4th are screened annually. Our 7th and 10th grade students are screened annually. Okay. So that's quite a lot of students in the district. I should have looked up numbers and I don't have them. The one thing about if a child has a physical, which they're mandated in kindergarten and 7th grade, we take the results off that. Sure. But even with children who have vision evaluations on those, some of them fail. Sure. I will say in kindergarten, most of the docs that do them in their medical offices, and they fail, they are very good about following up and making sure they go to an actual eye doctor. So are you the only person then in your school doing all of these screenings, or do you have other nurses that come? Or I have a health tech who will help me, and then we also, we weren't able to last year, of course, with COVID, but typically we have student nurses from UNMC or Bryan or Southeast Community College and other colleges that they train them. Their instructors train them on screening, and then we bring them in and help us. Besides vision, what other screenings are there that you have to get done? Height and weight and hearing. And hearing, okay. Now, when it comes to the vision screenings, what are the components that you test? Is it just the acuity? Is there anything with like near convergence or anything like that? We do far, near and far. Okay. Okay. So basically just reading the chart, distance near, see if we can see it. And exactly. And go from there. Excellent. Do you know, are all school districts, is there a standardized method to how they go about this, or do each one do their own thing, or how's that? Well, I won't say everybody does the same thing, but there are guidelines. Okay. There are state guidelines that are written for school nurses on how to screen, and then every spring or summer, I guess, because we just did it, like we did webinars this year, but like for new school nurses across the state. Okay. So they're able to know what to do and how to do it. Is there any special equipment that you need or need more access to for those types of screenings? We use the regular vision charts and the little near vision charts. We at LPS are very lucky that we have the spot screener. Oh, sure. We have 3 of them available to us to check them out. But I know smaller districts don't have that access. So let's say a little one comes in and struggles a little bit during that screening process. What's kind of the next steps that a parent might receive, or how do if they don't pass the first time? Then I bring them in and screen them one-on-one rather than in a group. Yeah. And a lot of times it's just they were too nervous around all their friends. Johnny was poking them in the back, doing whatever. So we just re-screen them. And then if they fail the second screening, then we have a form letter that we send home to parents that say, your child was screened on this date and this is what they, tested at, and we recommend follow-up.
Sure.
And then there's always a line in there, a paragraph in there that says if you need help getting that, contact the school nurse, and then we can reach out and see what we can do to help them get to those.
One of the biggest barriers, obviously, is need, and
Yes.
and how can we get, so we need to get Johnny help. How can we go about that? Are there resources that you're aware of that you have access to, or places that you can help point to patients?
For one thing, the National Association of School Nurses does provide gift certificates through VSP Eye of Hope. And so if you're a member of our National Association, you can order these and get to up to 25 at a time.
Okay.
And so we share them freely with any student in the district who needs them. There's also for our Title I schools, the last couple of years, we've been utilizing the Children's Vision Van from Children's in Omaha, which started with I think 8 schools in Omaha, and now they do, I can't even tell you for sure how many. My school's not a Title I school, so I'm not involved in it. But they come out once the nurse has done the screening, and for the students who fail, they will come out and bring their doctors and re-screen them and get them glasses if need be.
Yeah, I think Dr. Colby's one of them that does that. And he was involved in, and I was telling you about the research he helped with down in Beatrice, and I believe they took the van down there to help with that process. So that's a pretty cool project here in the States. It's hard, of course. It'd be nice to get it further out west sometimes.
It absolutely would.
For our friends out in the Panhandle or whatnot. But some other things too to be aware of. They don't have a lot of resources, but the Nebraska Foundation for Children's Vision does sometimes have the ability to get kiddos set up, or sometimes even reaching out. They may be able to help contact clinics in an area who might be willing to help a student out here and there too.
Absolutely.
So that's another good resource. I think one of the toughest things too as a provider is that it's such an easy thing that can really impact a kiddo's start to school and how they build their own confidence and get going in their educational pathway. And so I did just have a little kiddo last week, kind of right before school started, that had come in and was not a kindergartner, was a second grader, but it was the first time getting their full eye exam done. And I believe they had to move around, so it kind of fell through the cracks or whatever, and then he was doing fine. But sat down in the chair and was only about 20, 40 or so, and we got him glasses and the proverbial, that's what leaves look like on a tree. Just the stuff we don't know, because kids, obviously, they just think it's the way everybody sees. They don't know that it should be.
Absolutely. I had a student once who was in 5th grade who failed, and not by a lot. He was maybe 20, 40, and his mom called me and said, I don't get this. He's done, always passed. And I said, she's like, he's a great pitcher. He plays ball all the time. She went and got him glasses. He couldn't see, and he had some kind, I can't remember anymore, but some kind of, process going on. Yeah. And when he put the glasses on, he said, our mom had said to him, how is it you can hit the ball all the time? He said, I aim for the one in the middle.
Yeah.
But he had never thought to say that to a parent.
It seemed like to him it was normal, right? So yeah, he's seeing 2 balls coming at him.
Exactly.
Man. What are, from your opinion and just experience, how many students do you think, on a percentage wise, how many students do you think on a kindergarten level, let's say, come in and you find something undiagnosed that had never been picked up before?
Kindergarten's hard because they've pretty much been screened, but I would say I probably 10 to 15% maybe of my students a year.
That's a pretty fair number.
Yeah. And for me, because of my school, the majority of them, the referrals are complete.
Sure.
Some of the Title I schools, that doesn't happen. But that's why we try to get things like the Vision Van in there to help them along.
On that referral side of things, okay, so they have trouble with the screener, you come back, you check them out, send home the letter to the parents. And not that there needs to be on your end, because everything else you have to do, but then is there any kind of loop to close as far as checking on if they did get an exam?
We're required at LPS. We do 3 follow-up referrals.
Okay.
So like we send the original one, I usually wait about a month or so later, and then probably another 6 weeks later and send them out. Sometimes we do phone calls. If a teacher notices that a student's struggling, and especially it's one who I've referred, most of the teachers are glad to pick up that phone and say, you know, I understand that Johnny didn't pass, and I'm telling you, he's really struggling to read or see the board or whatever. And that a lot of times is the extra piece the parents need to hear.
Sure. Can you tell too from again that same experience, a lot of times once they get the glasses, can you tell a fairly quick turnaround in terms of their academic side of things?
Absolutely. Yeah. And kids will say, you know, they'll come in and say, I can see now. It's the best thing in the world. My own son was that way. He was in 2nd grade and told me he couldn't see. And me being the nurse that I am, I said, 6 weeks ago you couldn't hear. So I'm taking you in to prove that you can see. He's 23 and wears contacts. So it's my own story. Listen to your child.
Oh, for sure. You know, it is. It's tough though, weeding out what they're seeing one week to the next, for sure. But in terms of helping kids, are there times that you see issues coming through, you know, where they do well on a screener like that, reading off the words, but I don't know, and your instinct is there's still something going on here, but they're passing all this. Is there times you see that also?
Like, they try squinting or leaning forward, you know, past the 10-foot mark, things like that. And some of those, sometimes I will just call a parent and say, you know what, they passed, but I don't feel comfortable with this.
Sure.
And I've been doing this for 21 years, so most parents listen to me. Most.
I think that's one of the challenges on the provider side as the eye care provider, is that a lot of those kiddos will pass the chart. They can read the chart and distance and near, but then it gets more into alignment, how the eyes work as a team, how the brain integrates that into the learning process, and trying to figure out ways. So along those lines, are there any trainings that happen from a screening side of things that you guys get to even observe alignment or how the eyes are moving?
No.
Yeah. Is that something, do you think?
I think that would be something great. And like we talked about, I'm very involved in my school nurse association in Nebraska. Yeah. And I'm on the committee for our state conference. So
sure.
I think I'm bringing you guys' name up.
Okay. That sounds good.
Because good. I think that would be something very beneficial, especially like you said, for western Nebraska, the Panhandle, central Nebraska, where they don't have as readily of resources as we do here in Lincoln and in Omaha.
Yeah.
I think that would be good.
Because I think when you're, like your message you're giving to the parent, you know, and if you can still tell something's going on, or we'll get into IEPs here in a moment, but how is it that you can ask them or tell them, hey, we still think we need to go get their eyes checked, even though they can read that chart, there's still something going on here. So figuring out a way to relate that, give you guys the opportunity to be able to observe that and tell them would be beneficial. So in terms of IEPs, so as a school nurse, you know, what is your role in helping determine if a child needs an IEP from a special education side of things?
We're not a part of determining if they need it, but we will do a screening, a full screening, height and weight, hearing and vision for those. And especially if it's, you know, somebody who's not past a vision or a hearing, you know, we reach out to get them extra screening, like send it to the eye care provider, or our district will do some more extensive hearing evaluations. Because that's the thing parents always have to keep in mind, is that what we're doing is a screen. Yeah, sure. We're not doing an evaluation, we do a screen, so.
So are there times in those instances where you do the screening the first of the year or whatnot, and then, you know, something comes up and the little one's getting kind of set up for an IP, so then they request, hey, let's do the screeners again at that point? Okay.
Right. I see that a lot, especially, you know, once the teachers really get to know their students, you know, they'll call and say, This one just, I think that, can you screen this one? Because I'm just don't think they can see the board. I don't think they're, they're holding their book too close. Teachers know.
Yeah.
So
on another side of kind of how the eyes can intersect with school, obviously concussions are something that comes up, and especially when you get into middle school and high school and that area, or even if a little one has a concussion at home, but then starting to work them back into school. Is that a process that the school nurse is involved in?
Absolutely, from the get-go. We, I can just think of several offhand where, the eyes were a huge thing. I've had a couple that have had to wear sunglasses. I've had a couple where, their eyes just do this funny little twitching thing, and they think it's the result of the concussion. We have them come in and lay down in the dark health office just to, well, we make it dark for them. It's not like it's dark all the time.
Sure.
But, so things like that. So yeah, vision is a huge part of those concussion kiddos.
Excellent. What do you think, are there resources that we would be able to help you out with, or help the nurse association, school nurse association out with, or what kind of things might be beneficial?
I think, if we knew of some providers who would, and not asking that you do everybody free gratis, but if we just knew that while we really have this family struggling, and even though they have insurance, they can't even do the copay without paying rent, if we just even had a list of, where we could call and say, hey Drew, I've got this kiddo, I'm pretty positive needs glasses, is there any way you can work with the family?
Yeah.
So I think if we had something like that, that would be very helpful. And you mentioned the Nebraska Children's Vision Foundation. We've worked with Neil Powell for years, so.
Perfect, so you are familiar with that.
Very
excellent. That's another part of our group that we want to get a little bit more known out there as a resource for nurses and teachers and whoever to reach out to. So, all right. Well, thank you for joining us on Beyond 2020 for this episode with Kay Duncan and a discussion about school nurses and how we can all work together to help kiddos out as they get within their learning career. We do want to encourage everybody to look for the latest episode of Beyond 2020 at bettericarenebraska.com, on the NOA YouTube channel, and all your favorite podcast platforms, and also follow us on Facebook. If you have questions, please contact us at Nebraska Optometric Association. Until next time, thanks for watching and listening.